Hey, welcome to part 3 of the Hamstring Masterclass. My name is Dave O'Sullivan and you're very welcome to the Go-To Physio Hamstring Masterclass. Now in part 3 today, we're going to continue on from part 1 where we looked at the consideration of the subjective assessment and some key factors that's going to stop our athlete or our patient being able to distribute that ground reaction force as well throughout the body. And in part 2, we talked about some very simple assessments that we can do to really understand where to start with our treatment plan. Now in part 3, I'm going to reveal one of the hidden jokers in the pack that you may want to consider to desensitize to give the hamstring an opportunity to be successful when that foot hits the floor. Now this muscle and these tissues are very commonly impacted and often need attention. Now one of the key performance indicators that you're going to look at to spot this tissue is your hip flexion test. And very often when you're assessing and you're bringing your athletes or your patient's knee to their chest, they'll often say, oh, my hamstring feels really tight. But the problem is your hamstring isn't on full stretch because your knee is flexed. So in today's video, we're going to reveal the hidden joker in the pack, something to consider maybe with your hands-on treatment or even your rehab in order to make sure that you get long-lasting changes with your hamstring rehabilitation. So without further ado, let's get into today's video, part 3 of our hamstring masterclass. Okay, so a big muscle that I probably didn't appreciate as much as I respect now is in university is the Adductor Magnus. Okay, so the Adductor Magnus is going to hip extend, it's going to internally rotate and adduct obviously, but the Adductor Magnus has to lengthen, okay, quite a bit, especially as we go into terminal swing phase. Okay, so again, is there any protective tone in the Adductor Magnus? So the Adductor Magnus, it originates on the ramus, but also the ischial tuberosity. Okay, so again, if you think about that hamstring, okay, and there's forces as they're going towards those tendons, that Adductor Magnus will insert very close to the hamstrings. Okay, so again, if you think about distributing forces and the brain having intent, okay, so if we think about, okay, we have a choice. So if I need to hip extend, okay, then I've got an option here. Okay, the brain has a choice to generate torque in any particular direction. So if there's some kind of protective tone somewhere in the body, then we may be within reason to hypothesize that, okay, if there is some kind of perceived threat or nociception present, or we've had a previous injury in that area, then potentially the brain might go, okay, you know what, I'm just going to take stress off that direction of force, I'm just going to put it somewhere else. So are we seeing that Adductor Magnus protective tone potentially contribute to more of the other tissues to help as we are about to hip extend? Okay, so again, just to kind of clear that up for you, if there is kind of protective tone in the Adductor Magnus, is that potentially contributing towards maybe excessive forces going down other areas of the body? Now the problem is, a lot of athletes, when we actually bring them up and we bring them into hip flexion, they'll often report that the hamstring feels tight, whereas in actual fact, what they're feeling is the Adductor Magnus, okay? Because that Adductor Magnus, it takes up quite a bit of this posterior thigh, especially posterior medially. And if you think about it, the hamstrings aren't going to have a max lengthening capabilities in this position because the hip is flexed, okay? And this is the same as someone goes down deep into a squat. We have quite a requirement of that Adductor Magnus to lengthen at the end of a squat, okay? So you'll see a lot of athletes, and if they don't have that ability of those tissues to lengthen. Now when I talk about Adductor Magnus here, I'm talking about the skin, the fascia, all the nerves, the arteries, veins, everything needs to lengthen there, okay? If there is some kind of protective tone there, is that potentially causing that ischial tuberosity to not want to lengthen and almost go the opposite way, where we see that kind of bone tucked, okay? So when you actually bring the athlete up here, what I like to do is I'll almost draw a line in the center of the hamstring, and almost medially to that is your Adductor Magnus. And then I just like to palpate the tissue, and I just like to see, is that carrying any protective tone? And again, the athlete will usually report some kind of tightness here when we bring that hip up. And again, when I internally rotate Pete's hip here, I'm going to really cause that tissues around the medial side of it, the ischial tuberosity, etc., to have to lengthen, okay? Whereas obviously I'm going to shorten the part around the linea aspera where it inserts, but for the majority of the lengthening, I'm going to require that to lengthen there. Now, the other thing as well is we are tending to get a better idea of the fascial connection of the adductor magnus with the pelvic floor. So again, if that pelvic floor, as that tissue kind of continues up into the pelvic floor, if there's any protective tone in the pelvic floor, what we might be seeing is the adductor magnus reacting potentially, okay, in my opinion. So when that hip is flexed and we see that there's a bit of protective tone here, are we seeing that as a reaction? So again, if someone's stressed or, you know, they're anxious or whatever, we can see that the pelvic floor and the diaphragm can change its tone, okay? So if someone has had trauma, etc., that the pelvic floor and the diaphragm, they work in an anticipatory manner, okay? So if these tissues are carrying excessive tone for some reason, non-physical, then potentially is that contributing with the reactions that we're seeing with the adductor magnus, okay? So again, very, very important to consider the whole person here and the stresses that the person's been placed under. If it's a professional athlete, you know, contract issues, selection issues, poor performance, etc., that could be contributing to that athlete being anxious, stressed, worried, etc. And then we may see some kind of protective tone around the pelvic floor as a result, perhaps, okay? Again, we need to hypothesize a little bit here. And again, we need a little bit more research as well, obviously, to come out before we're probably very, very comfortable in saying for sure. But that's something that, you know, it makes sense in my mind that the adductor magnus may potentially be reacting to that. Okay, so that's something that I would look at here. If the athlete had some protective tone here and the decreased hip internal rotation, very often just decreasing the protective tone around the adductor magnus can be very, very useful. So if you just pop on your front piece, okay, so again with this athlete, whether you're doing some kind of isometric, you're doing some kind of lengthening exercise that restores, reassures the ability of that adductor magnus to lengthen, whatever you choose, that's your choice. Or if you're doing some kind of massage up into this area here as well. So again, remember the posterior thigh, for a lot of it, it's going to be adductor magnus, okay? So again, if I just come up through semimen tendinosis and I'm actually splitting my finger here, okay, I can feel here, that big chunk there is adductor magnus. So don't forget that when you are doing, if you are doing hands-on work, etc., and you're trying to decrease the protective tone around this area, you're trying to get some kind of modulation, a descending modulation about, then this is the area that we may want to focus on. And again, it goes right up to the ischial tuberosity here as well, so don't forget that, okay? So that's just an area that I just like you to consider and assess with hamstrings. So again, I like that hip flexion to be nice and clean, okay, and have no protective tone there, and especially internal rotation as well, okay? So I'd like the two of those tissues to be displaying that, okay, the nervous system is happy to let those tissues lengthen through a normal physiological range, okay? And again, everybody's going to be slightly different with their normal, but, you know, if we can get that athlete, you know, a good 45 degrees or whatever, without excessive tone happening, maybe mid-range, then I would be pretty happy with that, okay? So that's your adductor magnus. Just consider that with treatment, you know, whatever your treatment choices that you use. We have our own kind of preferred methods in the mentorship, which again, the new grad sports physio, I don't want to bias you too much with kind of other ways of doing it. I want you just to expose you to these things and just open your mind a little bit and consider all these tissues as part of the bigger picture in the sports injury setting. So there you have it. I hope this video has helped you to now not overlook the important role of the adductor magnus. It's a very, very important tissue that has to work well with the hamstring, as well as a whole host of other things. And that's going to be one of the big things that's going to help the hip be successful as well. So even if you have an acute hamstring injury, using your key performance indicators such as hip flexion, that's something that you can start to undo these reactions very, very quickly while you're allowing the hamstring to actually heal. As always, if you want more information, head over to www.thegotofysio.com/blog of loads of resources. I've got my free diaphragm PDF report as well there. That's something you're going to definitely want to be looking at with hamstring injuries as well. And as always, we'll see you in the next episode where we're going to start to show you now how to start to build up the load tolerance to your athlete in this hamstring masterclass. See you next time.